technologies. We would also like to thank our business and community members. Now, I would like to introduce our session speaker, Pamela Elgin, MA, LPC. Pamela joined the Freighter and Medical College of Wisconsin in the winter of 2020 after working there as an EAP consultant for some time. She is the senior EAP counselor, working exclusively with employees as a mental health resource for therapy, education, and debriefings. This is a covered benefit for all employees. She also works closely with leaders across the organization to look at better ways to combat the stigma of mental health in our workplace, as well as promote the use of mental health resources available to staff. Previously, Pam has worked in the hospital inpatient and outpatient sector, managing and facilitating groups and individuals working on behavioral health issues. She also worked in the university setting, making it easier for students to come forward to deal with such issues such as depression, anxiety, and in particular, eating disorders. Pam has had her own private practice since 1999 and has been doing employee assistance work for the past 12 years. So please let us all welcome Pam and give me just a minute to switch the presentation over to Pam's slides.
Thank you so much, Kelly, for that introduction, and welcome everyone. I'm so glad that you took the time to join us on this important discussion. The chat box is open, so if you have questions, feel free to put them in the chat box and we'll try to get to them at various points in the presentation. So we're talking today about mental health resilience and building a culture of well-being and compassion, which is a vital issue in the workplace, especially since people spend a lot of their time in the workplace. Why is there a stigma to around mental illness? We're going to go just briefly into a little bit of history. Kelly, if you could go to the next slide. Throughout history, many cultures have viewed mental illness as a form of religious punishment or demonic possession. As we know, people tend to have a difficult time and have learned to be uncomfortable around anyone that seems different. And we sort of have a standard out there of what a good person or a normal person looks like and how they behave. Mental illness is no exception to this. Negative attitudes toward mental illness and the people affected by it persisted into the 18th century and on to American culture. This led to the stigmatization of mental illness and unhygienic and often degrading confinement of those affected by it. So there we see a really good example of how the culture made these people out to be bad, unworthy of good treatment, dignity, respect, and they were sheltered away with, dirty, often low participation in supportive services. Finally, in the 1840s, Dorothea Dix lobbied the US government to fund and build 32 state psychiatric hospitals. We have one of those here, right here in Wauwatosa, but they were often underfunded and understaffed. Harsh criticism of them arose due to some high-profile stories involving poor living conditions and human rights violations. We even see examples of that sort of thing happening today as it comes up in news stories about patients who wander off, are missing, commit suicide, and issues like that. So they're not supervised the way they should be given their illness, which entails often, confusion and dissociative kind of behavior. In the 1950s, the deinstitutionalized movement, can't talk yet this morning, it's still too early, but the deinstitutional movement started and antipsychotic drugs were developed. They did some good things, but for the most part, they really just doped up patients so that it was very difficult to function. It was easier on the staff to take care of them because they were basically asleep or in a dazed state, sitting in chairs, watching television, or lying in bed all day long. They were rarely problematic or have any anger outbursts in that state. So it served the staff very well, but it didn't serve the patients very well. Thankfully, research was continuing to be done and more drugs that were effective but didn't sedate patients were developed. While this deinstallational movement was going on, communities fought back. They had tension and discord because not everyone agreed on what the problems were and the solutions for it. They banded together and protested and, often were unwilling to be respectful to these people who were moved back into the community. Labels of sin, judgment, spiritual punishment, demonic possession, and criticism of the affected people was a thread throughout time. Even today, people find themselves very judgmental, if they're honest, and uncomfortable in the presence of someone who acts differently. Even within the groups facilitating change, there was infighting about how that should be done. It wasn't an easy road, and there was more of that deinstitutionalized movement here in Milwaukee in the last 15 years. Throughout history, man has not done well in the areas of sensitivity, compassion, and inclusion. Again, anyone that is different has been ostracized, made fun of, and treated poorly. We're here today, this morning, because we desire to make our workplaces more peaceful, accepting, and encouraging and supportive of all of our employees, including those with mental health struggles. We need to make our work lives safe and secure. Developing a purpose for why we want to do this in the area of mental health is really important. So developing a purpose statement is really key to understanding why we want to do it and to begin to form a plan of how we want to continue that safety in the area of mental health as well as other areas. That statement, here's an example, might be, we believe all the members of the community are entitled to an environment that nurtures collegiality and mutual respect. So again, it's important to know why we're doing this, what our end goal is, and then to continue to develop how we will do that. These are possible goals that might be included because obviously we want to reduce stigma. Because if that stigma isn't there or it's lowered, um, issues, negative issues involving our employees that have some kind of mental issue would be reduced. So one of the goals very well could be to help our employees understand what mental illness is. Many people have grown up and developed a mindset that it's this big, horrible thing and you never want it to happen to you. But statistics show us that 1 in 4 of our employees will experience depression or anxiety or both in any given year. That's 25% of our employees. So it's important that we have a community that really understands the issues and reduces and allows employees to feel more comfortable with the illness itself. And obviously, those that are affected in our community, our workplace community, may fall on a spectrum. Some we may never know that they struggle and they're able to keep it under control. They've got great outside support. And it isn't something that appears in any way at the workforce place. And then the continuum goes on to those that maybe are struggling with whether they need medication or not. So they go on and off their medication, bringing up problem times and need support from within the company and outside the company to be accountable for taking care of themselves. Often some of those people may have community support. They may have a social worker from the county that they live in, definitely a counselor in an outpatient setting, and a psychiatrist to help them monitor. And oftentimes you don't need to know that information, but to know that they have the support they need is what we need to know. We also need to develop more positive attitudes toward treatment. That treatment is a good thing, not a bad thing. That it doesn't say with big glaring bold red words that it's bad. That when you have to go for counseling, it is really bad. We also kind of battle some of the cultural beliefs about outside help like counseling and psychiatrists. Many ethnic groups continue to this day to say that we don't do that. We, as the culture that they grew up in, don't seek help. And so they deny problems, and then it becomes a problem in the workplace, and more attention needs to be brought to it from the workplace. So all of those help to bring about the goal of early identification and intervention. Sometimes the company will automatically know that this is someone who struggles with a mental health issue because they've made arrangements with the county to, allow people to come in and take certain positions in the company. And for that, I totally applaud the companies that are able and support doing that, because it gives people an opportunity to feel good about themselves, help support themselves, socialize. So it's very vital. And it can also help to create more inclusion in our workforce through handling some of the other things that we just talked about. So then the end result might be appropriate utilization of mental health services, long-term outcomes, getting faster service, them being able to improve their productivity in your companies and to reduce sick time. And productivity and sick time are some of the biggest expenses that companies have to deal with. And so doing the above things helps to decrease that in significant ways. Now we're going to talk about one of the first objectives that I have for today. What are some of the resources that employers need in order to create an emotionally safe environment for their employees? And first of all, I want to say that we need complete buy-in by the leaders of every company, that they recognize the validity of mental health issues and are engaged in helping to fulfill the goals that you have developed, mine being just an example. So someone from leadership or every leader really needs to go through sensitivity training and training to understand mental health issues and the employees that struggle with it. Because then they're involved, they're mentoring and showing other employees the importance of this project or committee, however you handle it. And it's important that they really understand what's going on with the workforce and are open to fixing those solutions. Many companies, they hear the problems because people volunteer them, but then are in denial of the significance of them and how it impacts the company. They may be defensive, like, that's not my responsibility. And they're blowing that out of proportion because, of things that they might want from their employer, and all those things generally are lies that leaders, managers, supervisors may believe that negatively impacts their treatment of people struggling. And though today we're talking about mental illness, this also applies to other kinds of disabilities and also, some of the problems we see between ethnic groups today. So one of the first things that I believe is important is after the leaders really work through their own biases and barriers to being open to this and engaged in problem solving. After that, it's important to develop or buy a test that would, or an assessment that would survey the climate of your workplace community. So what is climate? A workplace climate can be described as shared attitudes or perceptions that employees hold about their work group or work environment. Some of that we just talked about, defensiveness, resistance, anger, denial. And then they need to maintain a strong workplace climate in as an important component in building and maintaining a strong sense of collegiality and respect in the workplace. That's really important. That sense of inclusion, that sense of team, and the respect that everyone need in a workplace. One of the ways after a climate survey is completed, obviously you're taking a look at, what are the problem areas that rise to the surface? And one way of dealing with some issues of employees feeling different is to do a voluntary small group setting to help people engage in the beliefs that they grew up in. So measuring their own sensitivity based on the culture of the home they grew up in. How did your family of origin talk about and treat people with mental health? Oftentimes we see family settings because the parents and grandparents are of a totally different generational mindset. So often we see them with defending with humor about people with mental health problems, denying that it's a real issue, proposing the whole belief that people are making it up. And when you grow up as a child with that kind of environment, you're more likely to absorb that mentality yourself. Then to have the group talk about whether they know someone who's battled a mental illness or they themselves have. Now, this is a sensitive question, and many people will choose not to answer it, except for the fact that it's okay to deal and talk about whether others have a mental health problem. So based on that answer, talking then about what are some of the thoughts and beliefs and feelings that you have while you see someone else battling their mental illness struggle or your own. How do you feel? And this is really significant for leadership, supervisors, any type of leadership, to understand that those people feel a tremendous amount of shame growing up in a culture that rejects them as a person, makes fun of their battle, and generally is disrespectful and insensitive. Those experiences, battling it themselves or watching someone else, maybe a close friend or a close family member, talking about whether it's led them to be more sensitive and compassionate toward others. And how did their thought process change? What kind of feelings did it develop? And really importantly, did it have an impact on your behavior toward other people that may be struggling, not only with mental illness, but other things as well? And being able to verbalize those things is so important. Oftentimes people might think them, but until they verbalize them, it's hard to validate them internally and continue a commitment to those new thoughts, feelings, and behavior. That's shifting to a discussion about whether the culture of the workplace is a safe place for them. Could we go back to the previous slide, Callie? Thank you. that discussion is really important for leadership to hear what people are experiencing, on the floor or within the workplace community. Do they see inappropriate behavior, insensitive behavior, gossiping, harassment even? And is our culture of the company more open to employees who have depression or anxiety? If yes, if the culture of the workplace of the company is open and there are positive discussions and support for people who struggle with it, then what are we doing right? That needs to be validated, that the company is doing some things right in this area. And if the answer is no, what changes they might see that are necessary in order to change that answer to yes. And what they report may be very different than what leadership is aware of and the goals they have. So it's really important to validate and hear the answers to these questions. Actually, this next line should have come before this one because it's part of that climate survey. So I'll let you just read it. So what we're targeting here is the mental health knowledge in the workplace, sensitivity and understanding, as well as the inclusion factor. This survey may be important to repeat every year to see that the culture is changing. And if not, what continues to be focuses in order to bring about change. Having a statement about the purpose needs to be communicated to the workplace at large. Here's another example. We believe all members of the workplace community are entitled. Actually, that might be a repeat of the first one. I apologize. That group setting that I just talked about may be something that employees would do in person, or it could be a Zoom call. This is very much like other educational teachings that the company may already do, just with this topic. And then based on this kind of input from workers, leadership would develop policies that support the new culture, the new behavior, and the expectations of your employees. Through this, we're beginning to see the outline, the structure of a change in the community that's going to benefit the company and benefit workers. So like I said earlier, we start with the top leadership and work down so there's buy-in. And leaders need to examine their own thoughts and feelings too, not just employees. With leadership, there might be think tank small groups to develop that sense of curiosity and openness to problem areas within the company, to develop a plan, possibly a 5-year plan to educate and or counsel employees, even to give the group and the project and even the survey a name. This is just one example that a company used. Something's happening committee. So it develops some curiosity on the employee's part as well. I personally think that managerial and supervisory training needs to be a yearly event. For one thing, it could be done right at new hires for everyone, but then we need to continue to develop the vision we have and the necessary behaviors in our managerial and supervisory training for all new hires. And one way that I see this coming out in my work is how a manager approaches an employee with absenteeism or low productivity or just behavior that's not acceptable. All those things basically being grounded because of the mental health problem. In my line of work, not necessarily at Freighter, but at other places that I've done EAP work, I've seen employees get a warning 1, a warning 2 because of absenteeism. And no one bothers to ask the question, are you experiencing depression or anxiety that's driving your need to be absent from the workplace? And what kind of support can we give you? We all know how much it costs to bring on a new hire and all the training that's involved. So if we can retain a good employee who struggles periodically and needs some support, we want to do that. It's cost effective and it's good for the community, the workplace community, and it really supports someone who needs work, a purpose in their life, and is already dealing with a difficult issue. So mandating that managerial and supervisory training for all new hires and yearly may be one of the things that you choose to mandate. So moving on. Actually, are there any questions at this point? Kelly?
No, we don't have any questions so far, Pam.
Okay, so I want to remind people that that's what the chat room is for, and we'll look at questions again at the end of my presentation. So what are some of the resources that employers need in order to create an emotionally safe environment for their employees? Just like we just talked about, we need staff that have buy-in, that care about this issue, and care about their fellow employees. Staff that would be willing to be involved in training. In a hospital setting, particularly a teaching hospital, we have access to psych residents who may want to get involved or have some background in developing vision in this area that can help with surveys and the statistics around them. We also need, or potentially need, to hire from the outside a consultant or EAP social worker, psychologist, or licensed therapist that is a visionary for this issue, that has a passion for people and has experience in the transformational process. This may be hard to find, but we are out there. And gives us significant purpose and energy in helping a company like this. EAPs do give the employer options in dealing with a troubled employee. And I'm just going to put in a plug right now. Froedtert and the Medical College of Wisconsin started this on-site EAP work a little over 2 years ago. We've gone through some hurdles and some ups and downs, but we're currently really working on that vision of how to help our staff, who could help our staff, and what method we would do that in. We have chosen to be available in case there's a crisis in the hospital, multiple gunshot wounds that come into the ER, and new staff that need support, as this may be their first experience with something like this. Crises with employees who tell their managers that they're suicidal. The on-site therapist, like myself, is available to respond to that immediately, to meet either in person, Zoom, or on the phone with the employee and work toward a plan. Sometimes that involves them going through the ER and going to an inpatient setting. Sometimes employees will contract for safety, and we work on the support system that they need in order to reduce that thinking and urges, and develop a plan for what they would do if they found themselves in a setting like this. You know, that plan, maybe call 911 or go to the nearest emergency room or call your counselor. There's also hotlines that are available for people to call. So there are a lot of resources, and we need to help our employees find them. One of the things I've found in this work is that when people are struggling with emotional issues, it's like their brain is on fire. And the emotional centers for the brain are located in the back, whereas our thinking ability comes from the front. And if emotions drowned out people's ability to think clearly, that's when there's trouble. You know, that's when people break down, sometimes hurt themselves. The impulse to think about suicide or make a plan really happens because their emotional state has gone to a place that they no longer have skills to manage it. So they need help in lowering that emotionality so that their thinking ability can return. And that may take their own private counselor, EAP. It might take an inpatient setting, and or involving medication at any of those levels. But helping them to get to those solutions can be life-saving. I have lost count on the number of people who have said, you have helped save my life. I try not to let that get to my pride, but it feels good to be involved in helping people find their purpose and meaning again, to be able to look back at those experiences and validate that, no, I do want to live, and these are the things I want to live for. Sometimes employers and in particular, if you have an HR department, have to have some tough conversations with employees. And the question is, who should do that? Really, in essence, just like your doctor, you want to have somebody that has good bedside manner, that can have those conversations calmly, matter-of-factly, gently, and still firm, that help employees find boundaries around their behavior. For instance, that example I gave earlier about the employee who got a level 1 warning. In our company, you get 3, and then you get let go. So sometimes it's important that the EAP or a trained counselor might need to be present in that discussion about their behavior and getting a level 1 warning. This can help the employee in so many ways to then, after the meeting, have a separate opportunity to talk about their reaction to that and to develop goals and be reassured that they can accomplish those goals. And here's how we're going to do it. The same method can be used with a warning 2 and even at a warning 3 and getting to the point of being let go. Because as we know, employees who are let go still have support available to them from the company for a set period of time. I mean, we know that as job coaching, but it can also be access still to the company's EAP if we choose. So that person needs to really be trained in not having defensiveness, but openness and support to our employees. I know of an employee that, and I spoke of this a little bit earlier, got a level 1. It was because of absences. There was really hardly any discussion about why the absences happened. And at that point, the employee was so filled with shame that it was way too vulnerable a topic to bring up in that setting. So in that case, whoever was managing the difficult conversation didn't know what was behind the absences, and there wasn't freedom to talk about it with the employee. That same person went on to a level 2 for the same issue, and it continued to not be discussed. Sometimes that leader may suggest counseling or a job coach or such. But again, what's behind the absences isn't really out on the table. This person also activated outside EAP, and we really have to monitor how well our EAPs respond, because in this case, after several months, they still had not gotten assigned a counselor through that particular EAP.
I apologize for the interruption, but did Pam's audio go out for anyone else?
Yes, her
Yes.
audio and her picture.
Yes.
Okay.
So we'll
All
give her
right.
a few moments to try to log back on. Apologize for that. In the meantime, if anybody has any questions for Pam or anything, go ahead and put them in the chat, and then I will address them as soon as she logs back on and we get through her presentation. Thank you. I'm going to try giving Pam a call to see if she's able to log back in. We certainly apologize for this.
While we are still waiting for Pam to join us back here, thinking she's having some technical difficulties, wanted to share some information about an upcoming event that the Disability in Wisconsin group has. So I'm just going to flip my screen a bit and share about our Wisconsin Ability Summit that's coming up. So give me just a second and I will do that. In case anybody is not aware or is not on our email list, Disability in Wisconsin is hosting our Wisconsin Ability Summit, which is a one-day virtual conference, and American Family Insurance is sponsoring that. The focus of the conference this year is going to be on educating, hiring, and recruiting managers. So please check that out. You can visit our website at disabilityinwisconsin.org for more information, and registration details will be shared soon. Again, apologies about the delay here. We always have to be friends with our technology, so it looks like today was not in our favor. If you can just be patient with us for just a few more minutes, we hope to finish up the presentation with Pam. So thanks again for your patience.
Hey, everyone. I guess we're going to, I haven't seen Pam being able to log back in from behind the scenes of the presentation. So unfortunately, we're going to end the presentation right now, but we'll definitely send you a copy of Pam's PowerPoints. We'll give you these few minutes back into your day. We don't want to sit, have you sit here and wait till we see if she can log on. So again, we apologize. And we will send you a copy of Pam's PowerPoint. And Mark, you put a question out there. I have already copied that and I will send that over to Pam so she can go ahead and address that for you as well. So thank you, everyone. And we apologize for this inconvenience.